Hi, so what brings you here today?
Well, I just got my puppy Benji from a shelter this past week, and I wanted to bring him in for his wellness visit. The shelter said he's about 2 months old and a German Shepherd mix, but they're not sure on the specifics. She's the runt of the litter, though, so she's on the smaller end of the scale for her breed.
Okay, let's start with a physical examination then. I'm going to listen to her heartbeat just to make sure everything's okay. This is odd. Benji seems to have a heart murmur. I don't want to worry you, but by the sound of this heart murmur, Benji could possibly have a heart defect known as patent ductus arteriosus, PDA for short. We should do x-rays to determine for sure though.
Okay, what exactly is PDA?
I don't want to worry you, so we won't go into the details unless it's necessary, but generally it's a heart defect where an opening in the fetal heart that was meant to close during birth didn't.
Okay.
Unfortunately, by the looks of these x-rays, it seems that your dog does have patent ductus arteriosus. As you can see here, the left ventricle, the left atrium, and left pulmonary artery are all enlarged. This is due to the turbulent blood flow occurring in the heart as a result of the heart defect PDA. Basically what's happened is that the fetal heart has three main shunts that carry out the circulation of blood prior to birth. These shunts are called the foramen ovale, the ductus venosus, and the ductus arteriosus.
Okay, so what exactly do these do, and how would a defect in one of them affect my dog?
Prior to birth, the septum, the wall separating the right and left atrium in the heart, has not fully formed yet, and in its place are the septum primum and the septum secundum. This is where the foramen ovale comes in. The foramen ovale is a small passageway whose purpose is to shunt blood past the septum secundum and then through the ostium secundum so that the oxygenated blood can move from the right atrium to the left atrium. The other two, the ductus arteriosus and the ductus venosus, are blood vessels that allow blood to bypass the lungs and liver respectively, as they are not yet fully functioning. After birth, the blood vessels seal and become the two ligaments, ligamentum arteriosum and ligamentum venosum, while the foramen ovale is closed by the septum fusing, forming a small depression in the heart known as the fossa ovalis. What is happening in your dog is the ductus arteriosus has failed to seal, so the oxygenated blood is still bypassing her lungs. This also explains her small size, as animals with this heart defect tend to grow at a slower rate.
So how can we treat this, or is that even possible?
Yes, it is possible to treat. Generally, I would recommend an open chest surgery known as a thoracotomy. However, there is a less invasive alternative known as cardiac catheter-based occlusion, but considering the size of your dog, it wouldn't generally be my first recommendation. I'm going to refer you to a veterinary cardiologist, though, with whom you can talk more thoroughly about treatment options.
Right, thank you.